Assalamu alaikum dear doctors. In this video I am discussing about syncope from the NICE guideline. So syncope is very important. We know that history comes syncope. Mainly it is vasovagal attack occur, but we need to rule out all the cardiac sign, all the red flag exclude. Then we prove that that is a vasovagal attack. Now the common complaints in pediatric population estimated less than or equal 15% of children age 8 to 18 years will experience more than or equal one syncopal episodes. History. What history we find in syncope? In most cases, diagnosis will be clear with a thorough history. Number 1. Number 2, obtained from patient and reliable eyewitness. And number 3, see causes for summary of differential diagnosis and clinical features that should be explored in the history. Causes. What are the causes of syncope? These are autonomic, vasovagal, simple or neurally mediated syncope. Age group is 10 to 16 year, uncommon age less than 6 year. Circumstances and activity before syncope. So before syncope, what she is doing or he, that is prolonged standing, hot or humid environment, crowded places, shortly after rising in morning, sight of blood, pain, fear, anxiety, dehydration, tiredness, being unwell. Then prodromal symptoms. Prodromal symptoms is very common, and this including dizziness, nausea, pallor, sweating, blurred vision, headache, lightheadedness, injury from fall, extremely uncommon. So before syncope, what the patient is doing, we will ask. Now, orthostatic hypotension. What is orthostatic hypotension? That is age groups 10 to 16 year, uncommon age less than 6 year. Definition is that drop in systolic blood pressure more than 20 mm mercury and or diastolic blood pressure more than 10 mm mercury within 3 minutes of upright position without moving. Circumstances and activity before syncope are prolonged bed rest, dehydration, drugs, that is diuretics, antihypertensive, vasodilators. Prodromal symptoms, that is very common. There is lightheadedness, dizziness, blurred visions, injury from fall, extremely uncommon. Now, postural orthostatic tachycardia syndrome, POTS, that is age group is usually teenage girl. Definition, increase in heart rate more than 30 beats per minute or heart rate more than 120 beats per minute within 10 minutes of standing. There is prodromal symptoms, very common. These are dizziness, lightheadedness, nausea, other symptoms including exercise intolerance and chronic fatigue. Injury from syncope is extremely uncommon. Now, situational syncope. Situational syncope is that circumstances and activity before syncope are micturition, cough and vomiting. Next, we are discussing reflex anoxic syncope, reflex anoxic seizures. The age group is toddlers, age 1 to 4 year. Circumstances and activity before syncope are sudden pain or unexpected distress, prolonged crying, breath holding. Prodromal symptoms is uncommon. Other symptoms including abnormal limb movements or posture, urinary incontinency, confusion or tiredness post-event, injury from syncope, most common, usually mild. Cardiac features. Cardiac is arrhythmias. These arrhythmias are tachyarrhythmia, supraventricular tachycardia, atrial flutter, atrial fibrillations, ventricular tachycardia seen with long QT syndrome, arrhythmogenic right ventricular dysplasia, ARVS, bradyarrhythmia, that is complete heart block, asystole, pacemaker malfunctions. So these are the cardiac cause can be syncope presence. Obstructive lesions are aortic stenosis, pulmonary stenosis, hypertrophic cardiomyopathy, pulmonary hypertension, mitral stenosis, constrictive pericarditis and tamponade. Myocardial dysfunctions of syncope are coronary artery anomalies, cardiomyopathies and ARVS. Very, very important, always important red flags. So the red flags for cardiac syncopes are exertional syncope associated with swimming, loud noises, chest pain, palpitations, supine position, known congenital or acquired heart disease, family history is sudden death age less than 40 year, inherited cardiac conditions and conduction disorders. I am again repeating the red flags for cardiac syncope because we should need to exclude all this point from the history. These are red flags are exertional syncope associated with swimming, loud noises, chest pain, palpitations, supine position, known congenital or acquired heart disease, family history of sudden death age less than 40 year, inherited cardiac conditions and conduction disorders. The red flags are early ischemic heart disease age less than 30 year. Other characteristics are absence of prodromal symptoms, injury can be common. Neurological cause of syncope. The causes are epilepsy, seizure activity, migraine and tumors. Clinical features including prodromal symptoms absent usually, injury from syncope is common. Other symptoms are abnormal movements or posture, abnormal eye movements, urinary incontinency, postictal confusion or sleepiness, focal neurology and preceding headache. Psychiatric causes of syncope are the causes including panic attacks, medically unexplained or psychogenic syncope. Clinical features including prodromal symptoms variable, hyperventilation or tingling sensation of extremities, multiple daily episodes, and stress factors. Metabolic causes of syncope are hypoglycemia, electrolyte disturbances, eating disorders, drugs or toxins. Clinical features is that relevant past medical history present. Example, diabetes, eating disorder. So diabetes, eating disorder will be in our mind during syncope. Evaluations, detailed history and examination. Baseline observations including heart rate and blood pressure. If orthostatic hypotension or POTA suspected, measure heart rate and blood pressure in a lying position, supine in more than or equal 10 minutes and standing position at 3 minutes, 5 minutes and 10 minutes without movement. Perform 12 lead ECG in all patients. See ECG interpretation guidelines. We see the rate, rhythm, evidence of pre-excitation, heart block, ventricular hypertrophy, and QTC interval. Management of syncope including vasovagal syncope or orthostatic intolerance group with normal examination and normal 12 lead ECG, reassurance and lifestyle advice. Avoid dehydration, avoid extreme heat, increase fluid and salt intake in diet. So, and if frequent or debilitating symptoms of or patient parental anxiety, refer to pediatric cardiology outpatients. So vasovagal syncope, we know the management now, and if there is any parental anxiety and there is any debilitating symptoms, refer to pediatric cardiology outpatients. Red flags of cardiac causes. See red flags of cardiac syncope, abnormal cardiovascular examination or abnormal 12-lead ECG. If present, discuss with the local pediatrician with expertise in cardiology or specialist pediatric cardiology tertiary center. All patients to be seen in pediatric cardiology outpatients. So this is all about syncope from NICE guideline. Please do subscribe and share MRCPCH with Dr. Emma Chaudhuri. Thank you.